thrombosis is one of the major causes of mortality in patients with polycythemia, essential thrombocythemia, and also with myelofibrosis. If you compare the rate of these events with the normal population, you realize that patients with these diseases can have 5 to 10-fold higher than the normal population. When I say thrombosis, I mean strokes, I mean myocardial infarction, deep vein thrombosis in the leg, or in some unusual sites, such as splanchnic vein thrombosis. As I said, all these events are very, very important for the patient because they limit the quality of life also. You treated these patients with cytoreductive therapy. Cytoreductive therapy is necessary because you are dealing with myeloproliferative disorders. So you have to control the myeloproliferation that occurs in the bone marrow of these patients. The second weapon against this disturbances is the anticoagulant drugs and also aspirin. Aspirin was demonstrated in a clinical trial that is able to reduce vascular deaths in these patients, especially in the arterial district. As I told you, thrombosis can occur in venous and also in arterial, but mainly in the arterial thrombosis in patients with this disease. 70% of thrombosis occurred in the arterial tract. What I'm going to say today is that in the studies we did, we collected more than 1,000 patients experiencing a thrombosis during the follow-up of these diseases. I mean polycythemia, essential thrombocythemia, and myelofibrosis. What we have seen is that in venous thrombosis, the results of current therapy are not as good as we thought when we started to do studies in these diseases. And the recurrences are particularly high, higher than in a patient without these diseases. So we have to work to reduce the entity of these rates of rethrombosis, venous thrombosis. Maybe something is different concerning arterial thrombosis, especially cerebral vascular strokes, TIA. With the current therapy, our patients can achieve better results than a normal population. Maybe this is due to hydroxyurea, so cytoreductive drugs that are particularly useful in these patients.